A new, powerful, revolutionary technology is a non-invasive, fully automated and portable computer-based system that provides quantitative assessment including heart rate variability, autonomic balance analysis, arterial health assessment, stress assessment, cardiovascular fitness test, and ECG analysis. Benefits all medical branches including primary care, cardiology, pulmonology, endocrinology, neurology, and pain management. The non-invasive innovative technology behind Q Medical involves computer analysis, a heart rate variability with a 3-lead ECG, and simultaneously measuring pulse wave velocity with a finger probe to get a comprehensive cardiovascular assessment of the patient, making it useful in most clinical disciplines of medicine. The autonomic balance analysis is obtained using an ECG signal to determine RR intervals during the entire measurement. The autonomic balance analysis measures sympathetic and parasympathetic activity and the balance of the autonomic nervous system from the HRV frequency domain analysis. The autonomic balance is based on using an advanced HRV frequency domain analysis adjusted by respiration signal response. Sympathetic activity and the nervous system acts like a car gas pedal, while the parasympathetic activity acts like the brake. If the sympathetic and parasympathetic activity is out of balance, you can be at risk for heart attack or stroke, and unbalance can also affect everything from breathing disorders to digestive issues. A cardiovascular fitness test is a cumulative fitness assessment that measures training or fitness level, cardiac and vascular coefficient, and the response of the heart vascular reaction during orthostatic stress, such as moving from a seating to standing position. These tests and assessments affect heart rate variability. Monitoring the body response stimulates such as medications and treatments. According to the American Diabetes Association, a patient history and physical examination are ineffective for early detection of CAN, therefore non-invasive tests that demonstrate accuracy are required. Pulse wave velocity assesses stiffness index, reflect index, augmentation index. In addition, pulse wave velocity assesses the reflection of the arterial elasticity and blood flow in the venous system, the contractility, tension and stiffness and the small arteries, and provides an indicator for left ventricular ejection power and elasticity of large arteries. There is a significant relation between left ventricle diastolic function and exercise tolerance in patients with left ventricle dysfunction and exercise intolerance in patients with heart failure, and preserve left ventricle systolic function. Pulse wave velocity is measured by the finger probe. As the heart contacts, it creates a direct wave which travels down the arm representing by the red curve. The direct curve is reflecting in the lower body and travels backwards through the arm representing by the blue curve. The direct wave and the reflective wave combine to form the dichrotic notch representing by the yellow curve. Pulse wave velocity is an indicator of cardiovascular disease progression and treatment status. Our pulse wave velocity analysis provides an assessment of the arterial elasticity of large and small arteries using a 2-circuit bidirectional finger probe. The blood pulse wave followed as it leaves the heart and travels to the blood vessels down to the finger. The Q Medical system takes a snapshot into the cardiovascular system and evaluate arterial elasticity or arterial stiffness, which is related with arteriosclerosis. Arterial stiffness is a major cardiovascular risk factor.